Today we are discussing about hypertension and its dietary management. Hypertension, otherwise the high blood pressure level. Hypertension, commonly known as high blood pressure, is a chronic medical condition in which the force of blood against the walls of the arteries remain consistently elevated. It is often called the silent killer because many people have no symptoms until the serious complications develop. Blood pressure is measuring in millimeters of mercury and it's recorded as two numbers. Systolic pressure, pressure when the heart is contracts. Diastolic pressure, the pressure when the heart relaxes between the beats. A normal blood pressure is generally around 120 bar 80 mmHg. Types of hypertension: primary or essential hypertension, its most common form, about the 90 to 95% of cases. No identifiable causes available. Develops gradually over many years. Risk factors are family history, aging, and obesity. Sedentary lifestyle, high salt intake, stress, smoking, excessive of alcohol consumption. Secondary hypertension results from the identifiable underlying condition. Causes: kidney diseases, endocrine disorders, thyroid disorders, adrenal gland diseases, and obstructive sleep apnea, and certain medications. Causes and risk factors: non modifiable factors are age. Risk increases with the advancing of age, and family history. A positive family history significantly increases the risk. Genetic: certain inherited traits may predispose the individuals. Modifiable factors and excessive salt intake. High sodium intake contributes to fluid retention and increased blood pressure. Obesity: excess body weight increases the cardiac workload. Physical inactivity, lack of exercise and contributes to hypertension. Smoking: nicotine constricts the blood vessels and raises the blood pressure. And alcohol: excessive alcohol consumption increases the hypertension risk. Stress: chronic stress may contribute to persistent blood pressure and elevation. Unhealthy diet: high fat, high sodium, and processed foods are increased risk, which will lead to increased risk of hypertension. And dietary recommendations for hypertension is the major part that we are discussing in this part. And the food which should include in diet: mainly fruits and vegetables, banana, orange, apple, pomegranate and papaya, spinach, broccoli, carrot, cucumber, beetroot. Whole grains, oats, brown rice, whole wheat, millets. Protein sources: fish, lentils, beans, low fat dietary products. Healthy fats like nuts, seeds, olive oil. Foods, foods which should limit the consumption: excessive salt and processed foods, fast foods, sugary beverages, fried foods, and excess saturated fats. Prevention: maintain a healthy body weight and exercise regularly. Eat a balanced diet, which means a balanced proportion between the carbohydrates, protein, fibers, and healthy fat also. Reduce the salt intake, avoid tobacco, limit alcohol, and manage stress and monitor blood pressure regularly. Hypertension is one of the most common and non-communicable disease in worldwide and a major risk factor of heart diseases, stroke, kidney disease, and premature death. Early detection and regular monitoring, healthy lifestyle modifications, and appropriate medical treatment can effectively control blood pressure and significantly reduce the risk of complications. Consistent adherence to dietary recommendations and physical activity and medical advice remains the cornerstone of successful hypertension management. Recommended diet is mainly low salt diet, fruit and vegetables, garlic and oats, potassium rich foods and like banana, plenty of water. As I told you before, with the hypertension or tendency to hypertension, mainly the people who are in the level of 140/90, it's above 140/90 is we consider it as a hypertensive patient, and 140/90 is the pre-hypertensive phase. So people who are in 140/90 also should take care of their diet. Mainly they should avoid excessive salt, pickles, peppers, processed food, excess tea and coffee, alcohol, smoking. And they should take the proper balanced diet daily for an healthy life, and they should have the regular exercise. Proper health and mental well-being means they should avoid maximum stress and mental relaxation exercise like yoga and all, yoga, meditation and all they can